Hello, my name is Bill Young. I'm the editor-in-chief of JCEM Case Reports. In this presentation, I would like to share with you a little bit about our journal and give you some guidance on how to use our manuscript template. Let me just share my screen with you here. So our mission at JCEM Case Reports is to provide a forum for internal medicine residents, endocrine trainees, and junior faculty to publish clinical articles. In addition, we want clinicians in practice to share their interesting cases, either as a case report or an image in endocrinology. What is our standard of acceptance? Case report must be factual, concise, well organized, presented clearly, based on logical causality, and easily readable. You need to follow our manuscript template, and that's the focus of this presentation. Provide a complete description of the case, include pertinent labs and images, and conclude with bulleted key learning points. We're considering two types of articles for publication: case reports up to 3 patients, and images in endocrinology. For the case reports, it can be a common endocrine disorder with unique diagnostic, ethical, or management challenges, or a rare endocrine disorder that presents with a new association, unexpected findings, or unanticipated treatment responses. Must use our manuscript template. This includes tips on how to polish your manuscript. Images demonstrate what the clinician sees in the exam room or on their computed imaging system. Images of rare endocrine disorders or unusual, interesting educational images of common endocrine disorders are excellent candidates for this forum. In up to 200 words, the figure legend should clearly describe the clinical context, physical exam findings, and computed image. So here's our website, and you can go to our author guidelines as shown here. And within that, there are several areas that you can click for further guidance. In this presentation, we're focusing on the case report template. You click on that, you come to this Word file. And the first page is a checklist that's for you. Once you've completed everything on this checklist, this page can be deleted. But number one, signed patient consent has been obtained and patient details anonymized. At submission, authors are required to affirm that a consent form has been completed for any case report or clinical image in which an individual, in whole or part, appears. Use of the Oxford University Press patient consent form is recommended. However, if another consent form is used from your institution, as long as it addresses the same areas as the OUP form, it would be fine. If you want to see the OUP form, you simply click on this link, and it takes you to the Oxford University Press patient consent form. Authors are not to submit the completed consent form to the journal. Completed forms should be held by the author and treating institution according to locally approved procedures and be made available to the journal editors upon request. Journal editors reserve the right to reject papers if there are concerns about ethical procedures or informed patient consent. If the patient or proxy of a deceased patient cannot be traced and consent cannot be obtained, the case report can still be considered for publication, but only if it's anonymized and approved by the treating institution, with the journal editor's agreement and providing there's been sufficient identity masking. No more than 6 authors, all of whom will need read and approve the manuscript, not previously submitted to a preprint server. Everything's original, the manuscript, the figures, the tables, no supplementary materials. All lab values have been double-checked and are both conventional and SI units in all instances. This is an international journal. We want clinicians to be able to immediately recognize the lab value and what the reference ranges are, so that it makes sense to them. When a lab variable is first mentioned, you should include the reference range, whether that's in the abstract or the main text. Word count for the text, not including legends, references, no more than 2,000 words, no more than 30 references. Text should be double-spaced throughout. All pages numbered consecutively. Title page is page 1. We need continuous line numbering in the Word document for the peer reviewers to be able to cite specific areas of concern. Single column, 1-inch margins, appropriate figure specifications have been followed. We use AMA Manual Style and Stedman's Medical Dictionary for style and spelling. And as I previously mentioned, both SI and conventional units for all labs. And I'm giving you an example here. The morning serum cortisol concentration was 20 micrograms per DL, and parentheses SI units, then the normal reference range. All abbreviations expanded on first usage in both the abstract, main text, tables, and figure legends. You should avoid non-standard abbreviations. You follow the guidelines on in the template and completed a final spelling check and grammar check. In addition, per AMA manual style, you should avoid using possessive eponyms. So Cushing syndrome with the apostrophe should actually be Cushing syndrome. This syndrome does not belong to Cushing, it belongs to the patient. Same thing for Graves' disease and Paget's disease. These are just some examples. Do not use the words case report in the title. You have no more than 120 characters and spaces for the title. It should be concise, specific, and informative. You should not present the title as a question. In addition, the title should not be a play on words or have comical intent. Usually, this is culturally specific and does not translate globally. This is an international journal. Maximum 6 authors are allowed. Include all authors' full names and affiliations. We do not need degrees or professional designations. Include the email address, phone number, fax number, full postal address, ORCID number for the corresponding author. For the disclosure summary, include a summary of the author's disclosure statements. This is all on the title page, keywords, 2 to 6 keywords. Provide the word count for the manuscript. And again, that includes the abstract and the body of the text. It does not include the title page, references, figure, and table legends. And finally, the ORCID ID numbers for the submitting author and corresponding author. On page 2, this is your abstract. The abstract should be concise and factual in an unstructured format. 1 paragraph, 200 words. This is a challenge. Provide a summary of the case, important clinical findings, interventions, outcomes, and key learning points. It should not include citations. This is the most important part of your manuscript. It is read more than any other part. Abstracts and PubMed are how others decide whether to read and cite your work. It must stand on its own, and you're limited to 200 words. As I said, this is a challenge. Limit the use of abbreviations in the abstract. And I suggest you write the abstract after you've completed your manuscript. And this way you minimize data discrepancies. You need to use these mandatory section headings. The first section heading is Introduction. Explain why the case is important and frame it in the context of existing literature. Next section heading, Case Presentation. Detail the clinical presentation includes signs, symptoms, relevant medical or family history, and again, de-identify patient-specific information. If the patient was a policeman, you should not include that unless it's critical to the understanding of the case or the medical condition. Diagnostic assessment. discuss the physical examination findings, lab testing, imaging studies, and diagnostic challenges. The next section heading is treatment. Detail key management decisions. Use generic names for all medications and provide the dosages. Next section heading, outcome and follow-up. Provide details on patient outcome, duration of follow-up, and status at last follow-up. Include adverse or unanticipated events. The next section heading is discussion. You need to summarize similar cases in the literature and applicable clinical practice guidelines. Discuss the key features of your case and what were the limitations of evaluation and management. In the discussion, you need to be focused, concise, brief, to the point, succinct, and crisp. I think you get the idea. The next section, this is important, your key learning points. 3 to 5 bulleted learning points that highlight the key messages for the reader. Then acknowledgments. This is optional, but this is where you'd list collaborators or mentors who are not listed as authors, but who contributed to patient management or the development of the case report. Next would be contributors, with the initials of the authors listing what the different authorship roles were. Funding, list any sources of funding that are pertinent to the manuscript. If there is no funding, simply state no public or commercial funding. Disclosures, any actual or perceived conflicts of interest for all authors should be listed here. If there are none, simply say none declared. Inform patient consent for publication. This is key. Select the appropriate statement as shown in the author guidelines. Data availability statement. Select the appropriate statement as shown in the author guidelines. References. In general, case reports shouldn't need more than about 10 references, but if they're needed, if you did an associated literature review, do not exceed 30 references. All references should be numbered in parentheses in the text sequentially. Use AMA manual style for allowable references. Preprints or manuscripts under review cannot be included in references. Tables. If needed, tables must be original and numbered based on the order in which they appear in the text. Each table should have a descriptive title that helps the reader interpret the table with minimal reference to the text. Each column should have a header. Include units of measurement and reference ranges for all laboratory values, again, in both SI and conventional units. Each value in the table must be accompanied by a unit of measure. Abbreviations used in the table should be expanded in a footnote. As an example of a well-formatted table, we've provided you a link to this article at the bottom. Up to 6 original figures are allowed. Figures should be numbered based on the order in which they appear in the text. You should crop images that only pertinent content is visible. Identifying patient information is removed. Each figure should be accompanied by a figure legend. The legend must be understandable without reference to the text. Expand all abbreviations on first usage in the figure legends. If multiple panels are used in a figure, label an A, B, C, and so forth in the top left corner of the image. Preferred image formats, EPS, TIFF, PowerPoint, PDF. The rest, JPEG, and the others listed here are not preferred and will not be accepted. Finally, the Word file, save your Word file using the corresponding author's last name, underline the month, underline the year. Do a final spell check with your word processing program. Have colleagues read and review your manuscript to make sure everything is logical and has good flow. Have a native English speaker review and edit your manuscript. Consider using resources found on the journal website. Again, here's our journal website address. And for language editing and original figure presentation related services, as I pointed out here in the bottom left, Endocrine Society members can have a discount for this service. So to summarize the key steps for successful publication in JCEM CR, start with a good case. Get signed consent from the patient or a deceased proxy. If none is available, then from the treating institution. Use the manuscript template. Present the case clearly. Conclude with bulleted learning points. Anonymize the case and the figures. Have colleagues give you feedback. Have a native English speaker review and edit your manuscript, and then submit. We look forward to receiving your case reports and images in endocrinology. And hopefully in this presentation, some of these tips will be useful as you put your manuscript together. And we're always available for any questions you may have on the journal. Thank you for listening to this short presentation.